Hello, my name is Cordula Ahnhudt-Franke. I'm a dermatologist born in Germany and working in the beautiful island of Mallorca, and I have specialized in aesthetic dermatology and laser dermatology. We are going to treat our 41-year-old patient. She has the initial signs of skin aging, of photoaging. She has a couple of age spots on her hands, and we are also going to rejuvenate them with the 1940 fracs. She has a party to go to, and she would like to rejuvenate them a little bit. We can see on her some of the lentigos as well, which we are going to treat with the IPL single spot, before we will also use the fracs 1940 on her hands. Okay, I prefer to use a template here because we only want to treat the pigmented lesions, so in her case it's not really necessary to treat the full hand. This is also, of course, to save downtime and to give the patient not an extra problem with swelling or redness. Okay, let's have a look. Here she's got some very light ones. This is probably not better to treat them with a PR handpiece. I'm going to try with the VL, but let's see. Yes, so here we can see we do have a little bit of change of the color, but it could be more. So I would change to the PR handpiece in her case, because these are very light and very fair lentigos solaris, so the PR is a little bit more potent in this case. The system is recommending us 7 joule with a double pulse and 10 milliseconds delay. I think this should be a good parameter to treat the hands. We are not too aggressive, but because she's still a little bit tanned, I would be careful to not over-treat her. So as we said, she has very little. She does this treatment every year, so this is the great thing, you know, and people maintain the skin very well, and she's one of our clients who really takes very good care of her skin. So here we can see this now very well. We have a really good oxidation process on this one. Let's treat these ones here. Okay, great. We've been treating the whole chest, you know, with a really effective setting. We have a really good reaction on the vascular component and on the lentiginous, but there is not much redness involved. So this is so fantastic about it, and this is of course due to the selective wave band technology, which allows us to treat with a very low energy right in the chromophores, melanin and hemoglobin. If we touch your skin, of course we do see a little bit of loss of elasticity. We do see the normal photoaging signs. Yeah, so, but I think today we are going to concentrate on IPL and the fracs 1940. When she will come back next time, I would advise her to do also a collagen remodeling, the dermal remodeling, and to work then deep in the dermis, either with the Pico Wave or with the fracs 1550. We choose the fracs, the rejuvenation mode. She's again phototype 2, low suntan. I'm going to use the phase mode, so we are in 10 millijoule. This allows us to do a really good treatment on a skin like this. If it's a delicate one, then I would rather reduce the energy a little bit to 8 millijoule, but in her case I would stick to 10. And we work with 10 millimeters spot diameter, and we can even go to 35% of coverage. And now already, if you touch the skin, you can feel that the skin is already nice and smooth. So this is something, it's just a baby, like a baby. So we already treated the lenticles, and now we are rejuvenating just the surface of the skin a little bit with the Frax 1940. So now we can see that we also have a bit of a reaction in the epidermal, not only of the spots that we have treated before with the IPL, like those, but we also have a slight darkening of the finer epidermal pigment. We can see that she's been exposed to the sun, so she's been a bit more in the sun than she was actually aware of, and you can see there is quite a strong oxidation, you know, of some of the lentiginous, much more than on the right side. Yeah, even though we work with the same settings, but this is due to sun exposure that she experienced in the last couple of days. We always try to educate our patients in focus on the décolletage and on the hands at the same time as on the face, because otherwise we see quite a difference between the changes on the face and on the rest of the body, and this doesn't match at a certain point. So that's why it's so important really to treat those areas as frequently as we do treat the face.